We've received a number of questions that you've submitted about some of our eyelid surgery posts recently, and I'd like to answer some of those questions now. I'm just going to work down our list. First question, is eyelid surgery covered by insurance? In some situations, certain conditions can be covered by insurance, but more and more these days pretty much count on your eyelid surgery not being covered by insurance. Does it take up to a year to see your eyelid surgery results? No, it definitely does not take up to a year to see the results. It does take up to a year for wounds to finally heal, for all of the minor little nuances after surgery to sometimes settle down. But practically speaking, the vast majority of patients find that after about a week, they can return to normal work and social activities. After 2 weeks, about 80% or more of the bruising and swelling has resolved. And while there may be minor episodes of swelling if you eat salty food or have that extra margarita for several weeks or months after surgery, most of the time people see the results within several weeks after eyelid surgery. Can eyelid surgery be done with local anesthesia? Most of our patients choose to have surgery done with what we call IV sedation, meaning you're not all the way asleep under general anesthesia, but you're also not awake and hearing us talking and manipulating your eyelid and so forth. It's a relaxing, comfortable experience that patients aren't aware of during the procedure and wake up when it's all over. Is eyelid surgery permanent, or does it require touch-ups over time? Well, eyelid surgery gives results that should last for many, many years. Permanent is like death and taxes. I mean, that is permanent. And some patients may or may not, over the course of their lifetime, need to have additional touch-ups done. A lot of that's determined really by the genetics of how they age. So I'd say that eyelid surgery gives very, very long-lasting results. Can eyelid surgery tighten the skin around the eye? Yes. Eyelid surgery definitely can tighten the skin around the eye. But one thing to keep in mind is that not everything you can do with your finger as you pick up your eyelid is something that we can reproduce surgically and have it look natural. So sometimes patients will come in and say, can you just do this? And the answer is, it depends. But yes, surgery is a great way to tighten eyelid skin. Finally, if you have heavy under eyes, is surgery the only option? I'm not sure exactly what the question referenced with heavy under eyes, but for under eye problems such as marked puffiness of the lower lids or excess skin in the lower lids, surgery is probably going to be the gold standard treatment.